Hello and welcome to NHIS in a week. We bring you highlights of events within the authority and the scheme. My name is Vida Iduchumwa. Now the headlines. NHI Executive Management holds maiden meeting in 2023. Bayer AG and Giz visit CEO of NHIA. NHIA organizes in-house customer service training for district officers. Co-payment committee organized training exercise for members. NHIS boss donates to some health facilities in Accra. Now the details. The NHIA Executive Management on January 10, 2023 held its maiden meeting of the year. Chaired by the Chief Executive, Dr. Bernard Okoboy, they looked at strategizing to deliver on their mandate. The CEO was joined by his three deputies, Mrs. Vivian Adokobia, who is the Deputy Chief Executive in charge of operations, and Mrs. Yapukia Badin, the Deputy Chief Executive in charge of Administration and Human Resources, and lastly, Mr. Francis Owusu, who is the Deputy Chief Executive in charge of Finance and Investment. Moving on, representatives from Bayer AG and Giz visited the authority and had talks with the CEO to advance the inclusion of prostate care onto the National Health Insurance Scheme. During the visit, Dr. Okoboy reaffirmed the authority's commitment to venture into preventive health care and expand the benefit package with recourse to actuarial analysis. He charged NHIS Giz team to expedite the roadmap deliberations on this project. Effective customer service training program is aimed at improving employees' communication, problem solving, listening, organizational, and team building skills. When employees are trained well on these aspects, the way they deal with customers changes drastically. In the light of this, the Training and Development Department, in partnership with Client Services Unit of the Corporate Affairs Directorate, organized a customer service training for staff of the Adenta and Medina district offices. The Deputy CEO in charge of Administration and Human Resource, Mrs. Yapukia Badin, took participants through emotional intelligence and communication training.
We have heard a lot this morning, and I want you to think through and use the 4 skills in improving your interactions with your colleagues in the outside world. Be self-aware, know how you manage yourself, and be aware of the social environment and how you can relate to people and then improve your relationship. I want to say that it is not difficult to start changing some of our old ways, because I believe that we can do all things through Christ.
One of the participants, who is an assistant PRO at the Adentan office, Clifford Adifu, said he has benefited from the training and believes that his interaction with members will improve moving forward.
Personally, even my communication skills have been improved, and all the challenges that clients are facing, I can easily resolve as a result of this training.
Manager for the Medina District Office of the Authorities, Mrs. Patience Dankwa, praised management for the timely introduction of in-house customer service training. She added that the exercise will go a long way to impact on their customer relationship with members of the scheme.
I'm so happy CAF and then HR training department has brought us this customer service training to our doorsteps. I think when the CEO assumed office, he mentioned of 5 Ds, and one of the 5 Ds is about development. And since I have been a manager at the district office, there hasn't been any training for my staff. So I'm very happy to be part of this training and then to the staff. And this is going to go a long way for staff to improve upon the skills that they have acquired here.
Moving on, the National Co-Payment Committee of the Authority held a one-day workshop exercise for all district and regional co-payment committee members at the head office of the NHIA in Accra. The members of the committee were taken through the newly adopted co-payment committee guidelines to tackle illegal payments charged at health provider centers.
The biggest threat to the scheme is co-payments or illegal charges. When you go back and forth, the biggest threat to confidence in health insurance is illegal charges. But we need to have a fair idea of the levels of charges continuously so that we can be monitoring our threat and knowing whether the threat has become intense or it has been lessened. And that's what this committee is about.
With the establishment of the NHIS Knowledge Sharing Center to be situated at the University of Ghana Business School in the offing, our partners from the Korea Foundation for International Healthcare, KOFI, met the CEO of the NHIA to deliberate on progress made. Dr. Okoboy, who is spearheading this project, commended the team for advancing plans to make the setup of an academic institute purposed on Ghana's National Health Insurance Scheme become a reality. He was thankful to the KOFI team for supporting the NHIA for the development of research policy and agenda for the authority as the scheme marks its 20th anniversary this year. A delegation from the Tamale Teaching Hospital paid a courtesy call on NHIA management at the head office in Accra, reiterating the scheme's positive impact on healthcare delivery in rural areas. The delegation made up of the acting CEO, Dr. Adam Atiku, Director of Administration, Emmanuel Sena Kwesidonko Esquire, and Director of Finance, Mr. Danla Disaka, commended the CEO and management of the NHIA for the digital inventions and robust measures being put in place to ensure the sustainability of the scheme. Dr. Okoboy expressed gratitude for the visit and intimated that the hard work to keep the scheme running is worthless without vibrant healthcare providers such as the Tamale Teaching Hospital. He admonished the management of the hospital to play a part in strengthening the scheme by expunging payment of illegal fees charged NHIS members. The National Health Insurance Authority donated some emergency trolleys, wheelchairs, and electronic blood pressure monitoring machines to 3 health facilities in Accra during the festive season. The Accra Regional Hospital, popularly known as Rich Hospital, the ICU at Kolebu Teaching Hospital, and the Kanishi Polyclinic were the 3 hospitals that benefited from this exercise. Presenting the items on behalf of the authority, the NHIA boss, Dr. Okoboy, said the donation was to assist the facilities in its delivery of healthcare to NHIS members and all other patients. Healthcare staff who were duty on that day were also treated to sumptuous meals from Papa's Pizza, which collaborated with the NHIA to put smiles on the faces of the staff.
Here we are. We have essential workers who find themselves on duty. And so usually, because of my connection with the health sector, every Christmas, especially on the holidays, I make sure that myself and my team will visit the health facilities, the emergency centers, to support the health workers and to let them know that we appreciate the effort that they make. In the midst of the celebration, if anybody falls down, there's an emergency, these are the folks who have left their families and are here to make sure that our lives are preserved. So it's when I was at the ministry as a deputy, I used to encourage my staff for us to do this, and I'm happy that management and board of National Health Insurance Scheme have gladly embraced this particular initiative. We have visited, this is the 3rd facility we visited. We've been to Kolebu Teaching Hospital, we've been to the Greater Accra Regional Hospital, that's a Rich Hospital. This is the 3rd one, and in the new year we also visit some facilities. Remember that at the National Health Insurance Scheme, December now is our month, and we encourage all Ghanaians to register and put themselves onto the National Health Insurance Scheme in December.
National Health Insurance.
Who's wearing it? Please come. This is on. So that's the app.
Motu saa na mo abaye saa ayi ni jibe na eni aso because eyi obia na ekai say ejuma ye for na say apodin my fault. Yeah, big yeah, now the back high but if we are on Benjamin say holiday, I doubt we are edge only the push for we did down normally shade to my day until they say to me a kind now also up and also no one for the sapine or the wheelchairs stretchers near the
Now to our very final story. The Volta Regional Minister, Dr. Archibald Lecture, has commended leadership of the National Health Insurance Authority for the increased efforts to improve operations and image of the National Health Insurance Scheme. He acknowledged that the image of the NHIS has improved considerably in the past few months and applauded the governing board and executive management for turning the NHIA into a reputable public institution. Dr. Lecture was addressing a delegation from the NHIA led by the Acting Director of Administration, Mr. Raymond Avinu. The delegation was there to pay homage and as well express gratitude to the regional minister for his tireless efforts in turning around the fortunes of the region, which emerged as the best performing region in the year 2022. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh and follow us on all our social media platforms displayed on the screen. My name is Vida Edichumwa Boateng. Thanks for watching.